now it's your turn. We've been promising you this for a day and a half. And what I'd like to have the audience do, and we have the mics, I was going to say disseminated, but anyway, the mics are around the room, and we'll do the same kind of process that we did with questions. But this time, each speaker, I would like for you to formulate one strategy for way forward that addresses any of those questions that are up on the slide. And if there is evidence to support that, be sure that you get a citation to Audrey or Rachel so that we can put them in, add them to the list of references that will be part of the report. So be sure that that information goes there, and then you don't have to, if there is a study being done, you don't have to explain all the details of that in your comments. So we're, and I'm well aware that we've been unbalanced sometimes in our side of the room, but we've got more people over there. So what we'll do is we'll take 3 ways forward from over here, this side of the room, and then we'll go over here, and then we'll go back until we run out of time. We will close with the panel each getting to make one more comment before we close. And as I said, we will get you out on time. All right, over here, ways forward. Now you were instructed to think about this. We've got one.
Hi, my name is Anik. I'm from the South African Medical Research Council and the Sexual Violence Research Initiative. I would have a point to answer your question around where are opportunities to coordinate or collaborate across countries to improve IPV prevention. Our experience at the moment, we're supporting 4 teams across Kenya, Tanzania, and Uganda on primary prevention intervention, development, and piloting. And it's been absolutely extraordinary to see how when you can combine learnings from 4 different projects, how much further it can drive the field. So though it's not published yet, we're getting there. I think that there have been extraordinary things to learn there, and it would be great to be able to coordinate some of those learnings with other experiences. I mean, Laurie's presentation this morning just struck me as something that there are a lot of points of overlap. And I know that the Sexual Violence Research Initiative, which is not only about research and not only about sexual violence, it's about sexual and intimate partner violence. It's a global initiative that's looking to promote and support research, but also looking at translating research and the uptake of research. And so people in the region are certainly welcome to join and let us know how we can better support work being done on SIPV in the region. So those are just sort of the 2 main things that I wanted to add.
Thanks. I'm Lori from Raising Voices. I have many program ones, but I'm actually not going to do a program one. I'm going to talk more about a research one. I think that in this room there's a lot of program people and there's a lot of research folks. And consistently we see at a program or activist organization level that the data is not accessible to programmers. And I think we really need to figure out ways of popularizing research so that research can get down, like as Jesse's saying, so it can actually reach the people who are doing and designing programs, because right now it's great that it's published in lots of academic journals, but the majority of people doing programming are not really accessing those. And so it's like this huge gap, yeah, and so really trying to figure out ways, creative ways that help people figure out beyond the numbers. That's great, that worked, but so what? So what do we need to do next time we develop our own programming? And I think that that's really critical.
Thank you. My way forward is slightly different, and all the bullets mentioned there, I've tried to answer them as an individual of what I'm going to do in the way forward. So it's kind of micro level, but it can then build upon the snowball effect. So number 1 is I would like to go back home and conduct a study or a survey on the impact of IPV on child health and development. I would like to do a research on IPV in the university, in the halls of residence, and their impact on their performance in the university. And then take this issue very seriously and start from my circle of influence. It may be very difficult for me to influence parliamentarians or other people, but I can start with my own class at the university, in workshops like this, in my clinic outpatient visits, in the media where I give some talks on health issues, tetanus, polio, and now IPV and child health. And then once I get the data from number one, I can then start talking to the stakeholders that there is data available on child health and adolescents involved in this. And I would like to definitely collaborate with other researchers and inter-department as well as inter-university to see if these things can happen. And while I do my hospital rounds and things, I will keep on mentoring children and students, saying that, oh, this child has got a very circumferential burn at the buttocks. It's because the child was held by his legs and his shoulders and put in the hot water. So this is child abuse, and therefore look for IPV in this family as an entry point. We usually see IPV and look for child abuse, but you can go for child abuse and find IPV the other way around as well. And then look into the power factor and the inferiority complex which might be happening in these men, and try to see if you can talk to the men and convince the fathers to come to the clinics. At the university level, maybe I will start a campaign by asking the university website to have a small little box saying violence is not right, intimate partner violence can affect, or some campaign messages all the time flashing in the website and in the social media. This is what I think I'll do when I go back.
I'll speak to the second point on how we communicate more effectively, and I think it has come out mainly in today's session. I think we need to speak in a language that various constituencies that can identify with, we need to speak to their priorities. From the SASA session, I saw community-led initiatives. You know, we all want happy families. What are we going to be, what as a community can we do about that? The last presenter spoke about speaking to planners and finance persons, cost effectiveness. What is the cost effectiveness of our intervention? How is it going to affect the national priorities? Judicial officers, they want to talk about what is their role in enhancing access to justice. So what can my role be in improving access to justice for women who come to my court?
Thank you very much. Mine is just to see a big opportunity that has been provided here by UNAS and IOM. And I see some other players here trying to address this issue. I was just wondering, is it possible for us to come from this place with, as a network that is going to address this issue, and then be able to share? We have platform through which we can share either research questions or the research evidence, so that we can be able to share either through webinar or through other channels. Then from there, I would want to invite you to Access Best Practices Forum, so that all these good research outcomes are presented in those forums, and decisions can be made which are taken by the health ministers to make a macro level decisions so that they can be implemented at regional level. Thank you.
Thanks, everyone. Coach Simon Peter. Mine goes direct to point 3. I think we can come up with a network engaging all other stakeholders, the CSOs, and even some of the government sectors in different countries, Uganda, Kenya, and Tanzania. I know intimate partner violence brings some criminalities, which criminalities needs to be adjudicated in case of laws, in courts of laws. But at the end of the day, since it is criminal, it becomes a state court, a state case, whereby the state must work hand in hand with the witnesses to ensure that the accused gets his fate. But at the end of the day, we find such women are now taking on responsibilities in the family that even some of us women, we underlook. And at the end of the day, is a victim. It's going to be very expensive for her to facilitate the witnesses for the state to win a case. At the end of the day, this woman is going to feel ashamed. The witnesses are going to say like, me, I don't have facilitation to go to court. And at the end of the day, case is going to be withdrawn. So I think we must make it a move through a network in these 3 countries for these governments or the state to make sure that there is a common pool whereby it must facilitate witnesses for it to win such criminal cases. I think it will help us a lot. As we push this end, at the end of the day, the state has a very strong role to play. Thanks so much.
So I have a comment on the way forward in terms of research. I think it's really great that we've heard from a men's initiative in the workshop, and I think we need to actually catch up in the research world with regard to the burgeoning work that's being done to involve men and boys in violence prevention. On the research side, we've been spending a lot of years trying to figure out how to improve our measures of violence victimization, primarily of women. But this is something at the top of my mind as I'm trying to analyze or working on the interpretation of our results from the SHARE trial, is that we have a huge gap in really good, valid, reliable measures of male perpetration or perpetration in general. And I think that's something that's really a huge issue as well in this region. And I think as researchers, we really need to focus on coming up with better measures for perpetration and for work with men.
Okay, I promised that we would move to that side of the room. And we'll get back to you folks, but let's go to this side of the room because we've neglected them for a bit.
My name is Susan Hadley. I'm from the United States. I guess that's obvious now. I'd like to speak to the last bullet, about which I have heard a lot on reaching children and reaching boys and reaching adult women who are affected, but I haven't heard the term adverse childhood experiences. And that's the crux of all of this. A number of years ago, Vincent Folletti and Robert Anda completed a large research project on obesity. At least they thought it was going to be on obesity. The common connector between 50,000 women in the San Francisco area was intimate partner violence. And so that what they did was change their entire medical practice and go back and study IPV. And they've come up with a very usable term called adverse childhood experiences. All you have to do is Google ACEs. And most people who are either perpetrators or victims have a high ACE score during their childhood. So what happens to us in childhood affects us our entire life. And for that reason, I think it's about time, and this is kind of new for me, to turn around and look at prevention. And don't we kind of have to start with the youngest so that we can make some progress? Thank you.
Excuse me, I'm called Jackie Chosmire from, I'm a scientist, a biological scientist from Medical Research Council based here in Uganda. I can't agree with the previous speaker more. My point was on children's perspectives on child and family violence. And we have not had very little about evidence-based research in that area. And I think that some of these, there's high level of child abuse, especially here in Uganda. On the news, you'll see kids that have been burnt and several things. And how children perceive all that is not captured. And I also think that we need to introduce in the school's curriculum something on acceptable morals on prevention of violence. So those are my few points.
Hi. I think it's been a fascinating series of presentations and listening.
Thank you so much. I would like to also to have like 3 way forward. Like there's need to have multiple interventions, like for instance, legal interventions, health interventions, and the psychosocial support services in order to cap down issues of IPV. Then the other one is there's need to strengthen linkages at the region level in order to prevent the IPV. Then the other issue is this lady who's going to talk about it. But I can also say there was ICGR and there was a Kampala Declaration. So there's a need to review the Kampala Declaration and also include issues of the IPV.
My colleague has actually.
Can you please start standing up? I just got, this is being videotaped, and that way we'll be able to see you better and better record your responses. But we got yours in sound at least, but from now on, if everyone would stand. Thank you.
Sorry for that. In addition to what she has said, I was of the opinion that we should review the treaty, and if that is not viable, then we create an optional protocol to the treaty, including IPV.
Oh, okay, I can speak now. For me, in terms of the research agenda, I think, in terms of the prevention agenda, the current field has been saying, can we actually prevent violence? If we throw everything at it, do we prevent violence? And I think our response is yes. To me, the next generation of questions is how do we do that and think about models that are scalable? And what are the opportunities that different entry platforms give us for doing programming at scale? So that leads us to kind of the points that Nduku was saying about we need interventions that are scalable and affordable. So, do we need 20 sessions of a gender training program? Can we do it in 10? Now, those uncomfortable questions I think we need to tackle if we're going to think about scale. And then we need to think about, well, what do different entry platforms give? What can we do with development programs? What can we do in workplaces? What can we do in schools? So that the evidence can add up to what would a joined up strategy that actually addresses violence really look like? Because I don't think we have that picture in our head. And for HIV, we very much do have that picture pretty much. And that's what we need to be sort of working towards.
My name is Rose Nyakato once again from CARE International. I just want to make an emphasis on capacity building in the handling of all the survivors of intimate partner violence in regard to preventing further damage, ensuring that survivors maintain their positive regard and they keep their self-esteem, and most importantly, their emotional well-being. There are two case scenarios that we had, two presenters, one from Kenya, another one from Tanzania. We all remember the barriers in their referral pathway. If a survivor is to get a letter from one stage to another, to another, to another, I think to me this is very frustrating. We need to build the capacity of these persons who are being referred to, the survivors who are being referred to these persons. They need to know what are the survivors going through. They've already gone through a lot. Do they really need to take them through more torture? Because I imagine at every stage they have to tell their story. So you cannot tell this story 10 times. Are we helping them or we are causing further damage? So we need to emphasize on building capacity for every referral point where the survivors are going to ensure that we don't increase their damage or whatever they are going through. Thank you.
Good evening. Once again, I'm still Catherine Gidai from Men Engage Kenya Network. I have 3 points. One, speaking on the barriers and how we can overcome. Increasingly from several presentations, it has been noted that male involvement is a challenge for many organizations. And so for it as a barrier, then we need to scale up male involvement right from the policy level down to community level. And how we can overcome this barrier is by trainings on constructive male engagement and also developing materials that are context specific or on male engagement. And for this particular point, I would like to make reference to the baseline study conducted by Menken and also the policy report conducted by Menken. Second point is on priority items for research. And I think we've discussed over and over again about IPV costing research as one of the key research undertakings that we should take in our various countries. Kenya has started the process. Perhaps the rest of the East African countries need to get more involved. The second research priority area that I see here is getting specific responses of male attitudes on GBV, on IPV, on gender equality, and therefore I propose that maybe we need to see if it's possible to do what we call the International Men and Gender Equality Survey in these countries. Rwanda has done it. Perhaps the rest of us should think around the same. And lastly, on opportunities for coordination and collaboration, as my friend there has alluded, we need to perhaps come up with a cross-learning platform, be it online or how we design it, where we can share data across the East African countries. Maybe it's an exchange program, I don't know, something that we can think about. And lastly, to scale up these discussions on IPV, my proposal would be to take these discussions a little bit higher in the meetings that are going to come up on this particular, that focus on these particular discussions. For example, Beijing Plus 20, the Great Lakes Region consultations, and CSW 58 next year. Thank you.
Yeah, good afternoon. My name is Christine Mpiangu from Makerere University. I've been so much inspired by what has taken place here, but I've been kind of thinking about the younger generation in relation to the issue of fatherhood, and especially the whole idea of parenting. I I think we need to think and also take some interest in researching the parenting trends. What's going on in our homes, what's going on between parents and teachers. So we need to get to remind parents that they are great stakeholders in their children's future, because there is a whole big problem of institutionalization of values, thinking that values are acquired somewhere else in schools or in other institutions. But to get back to some of the very important issues and get to discuss with the fathers. So when we are thinking about modules like, like SASA, how can we go further to take those to influence programs like parenting, getting fathers back to their roles, because there is a whole big question of fatherhood. Many fathers are absent, and there is a very big problem. They are occupied with providing for the family, but not getting back to talking to children and playing their role. So fatherhood is a very big question that we need to get back to. Thank you.
My name is Kasa Daniel Mwanga. I work with Slum Aid Project. I thank you for the presentations made. My observation, though, was that in all the interventions that we're making today, the issue of good governance has not been well reflected. I'm of the view that all the research we do should help us to inform the communities, to understand their needs, articulate them, and then make those power corridors and the stakeholders or the office bearers to respond to the needs of the community. And by so doing, we can prioritize the issue of the IVPE, and it becomes an issue that can be addressed across the nation. Thank you.
Thank you very much. Thank you for those who have documented what you're doing and shared that. But this is just a call to all of us that we deliberately document what has worked and what made it, and highlight how it worked, and then what did it work, and try to fix it. But thinking that probably we could share the information under UNAS, because now we already know where UNAS is. Then the other one is adopt best practices, what we have learned from other countries, and then agree on guidelines and harmonize IPV in diversity.
Okay, we've got one more here, and then we've had some people on the other side that have been promised their say.
Sorry. I'm Diane. I'm doing research here in Uganda on policy and practice related to violence against women. So I would love to speak to point one. I'd love to see more research that is connecting prevention and response, and to see what is happening as we're raising awareness in communities and doing the mobilizing, what's happening, because of course more women are wanting to access services that don't exist. And so are we seeing a backlash there? In some of the research I'm doing, I am seeing some of that, and I don't know where that's going to go. I wonder if some of the research on SASA actually collected that data on the support phase, and it would be really interesting to go into some of the qualitative data more. And that's my other voice, and I am a qualitative researcher, so it's a bit of a bias. But I'd like to see us using more of the rich qualitative data that we've been hearing about and we know exists, but we see a lot of statistical data, but the qualitative data is telling the stories behind that, and I think we really need to coordinate more. So some of us who are doing strictly qualitative data research could complement some of the other research that's being done. I'll stop there. Thanks.
Got several over here.
I'd like to speak to point 2 about other people who need to be involved.
From listening from what we've been discussing for the last 2 days, I think we all agree that IPV has a criminal element to it. Most of the components of IPV comprise of criminal offenses. So I think we seriously need to consider bringing on board police officers and the judiciary, as was pointed out in Justice Batema's presentation. We need police officers on board, not only as people who are going to offer the support, because ultimately, whatever we shall be talking about, the interventions in the communities need to be backed up by the force of law. Because if you just talk, some individuals are very stubborn. Merely sensitizing them about it, the side effects might not be enough. But they need to know that at the end of it all, if you do not fall in line, there is the force of law to deal with you. So, however, the law is only effective if the implementers are sensitized, they are aware themselves. Because if you go to police, report a matter, and then the police officers are not giving you the due attention that you deserve, next time you're going to be discouraged. Other survivors will not be able to go to police. And I would also like to suggest that we take the screening process further, away from only the medical centers, further to the police stations and schools, because the teachers get in touch with children who are coming from such families, and then also at police, many partners come over to report. So they could also provide good screening grounds. Thank you.
Good afternoon. My name is Lucy Saro. I am working in the Ministry of Health and Social Welfare in the Department of Health Quality and Assurance. From this workshop, I am glad to hear the experiences and the consequences of IPV. So, my way forward, first of all, I think we'll have to sit down with my director, because in our department, we have been doing a lot to ensure quality services to all citizens of Tanzania. So I've come to find that we've been dealing with the infection prevention and also the post-exposure prophylaxis. But now I have learned that IPV services have not been addressed at all. So from this experience, I can see that in our department, in the Ministry of Health, together with other ministries, as we are privileged in this workshop to have the high ministers in community development and the children, also the Minister of Local Governments, together we can sit down and put the indicators so that in the supportive supervision when we are doing, we should address this IPV affected individuals to get those services. As we have seen that we have not done much in this aspect. Also, we are nearly in the final touches of developing post-exposure prophylaxis. So this is a high time to include those indicators which will cover this IPV. Thank you.
I'm Carol Bunga Idembe from Interreligious Council of Uganda, and our interest is on the last bulletin. What are the priority items for the prevention agenda going forward? And as religious leaders, our interest is on the post-millennium development goal 215. I think the issue of intimate partner violence should be a key area where we would think that, first of all, funds should be a priority to this particular agenda. But secondly, the issue of this time saying that at least by a half, as religious leaders, you cannot discriminate and say only half. We want totally elimination of discrimination against intimate partner violence. Thank you.
I'm James Kagari from Chambogo University. First, I will speak about a concern that I've just developed by attending this conference, a workshop, is that we may be talking about issues here, and maybe in the same building, there's another group discussing the same issue, maybe in other hotels or in other venues. So what I'm raising, do we have a coordination that somebody at national level captures some of these issues of our concern and link together and maybe put on a database that we can mine in there when we need to get this information. That's a concern. My way forward is that we have a research that is going on in my department of psychology, focusing on children, particularly on their perception of peace and conflict. One of the preliminary findings has shown that in our homes, there is a lot of quarreling, and the highest indicator is fighting. And these children indicate that they don't want parents who are drunkards. So my way forward is that I'll go and encourage my team to continue with the study and see how we can disseminate these findings for practice and policy formulation. Thank you.
My name is Datius Remam from University of Dar es Salaam, Tanzania. My way forward is centered around bullet number 4, about the barriers. So far, I think we have seen that one of the key breeding unit of the IPV is the family. And this family, as long as it will remain unstable, it is likely to continue generating and breeding IPV. Men, whom we have been talking about, comprising the largest percentage of the causes of IPV, are not stable, especially financially. And this, studies have shown that where men are not financially stable, they will definitely find ways of expressing their powers, because of course they are seeing how they are losing that power that traditionally they used to have. And now they are expressing it indirectly through every means that may be showing that, that women are becoming probably financially stable, financially independent. Therefore, they continue expressing their grievances through IPV. So I'm suggesting that the best way to move from here is to make sure that we also look the impact of IPV in relation to other sectors which are structural, like the increased levels of unemployment among men and the increased levels of losing jobs, so that we also look at all these in a comprehensive way rather than looking at IPV as an independent variable. Thank you.
I'm Esther from Parenting in Africa. Mine is on the first bullet, a research agenda. Perhaps it would be more beneficial if we had a reflection on indigenous knowledge for Africa. We are rich in culture, and perhaps it would be important to know where to draw the line. At what point does the culture shift from culturally acceptable practices to IPV? That is not clear. So as programmers, when you go out there, we are likely to face challenges between what is culturally acceptable and what is qualified to be IPV. And so even as we make recommendations, we should have a comparative study between indigenous knowledge, what was acceptable and what was good. And our recommendations should build on what is good from culture and marry it with what is presently acceptable. That will be beneficial to programmers.
Thank you. Yesterday there was a mention of the microfinance dealing with the IPV issue. Okay. There's an issue mentioned about the microfinance systems, and one of the things I was trying to look at in terms of financing is basically looking at the village savings and loans as one way of trying to reduce dependency in terms of response, but also in terms of prevention. As CARE, we work on the village savings and loans associations across over 30 countries. And slowly we are writing, documenting how it helps to deal with violence among women and girls.
And it's with time, probably the next workshop on the documentation probably will be able to share what we have found. But however, I've brought some materials, some DVDs that I've left with the team in case you want to learn more about the village savings and loans and how it's helping to deal with the issue of gender-based violence. Thank you.
Nakalembe Judith, and my point is going to be on bullet 5. I'm from Uganda Women's Network, and we are handling survivors of gender-based violence and domestic violence, which is IPV per se. In my observation, we need to revive the LC court system. We realize that these are the courts of first instance in the different villages. And these are the people that, the few like LCs that are existing, they're the ones that are handling cases of IPV, but we need to train them because they don't know what they're doing and further revive so that it is a duly, it's a full court that sits as opposed to the one person who will sit and adjudicate over the matter, yet is really, really gender insensitive. Then further, I realized that accessibility to the chief magisterial courts, you realize that most village courts or most district courts are not gazetted into chief magisterial courts, implying that many of these survivors end up being frustrated and end up just sitting home and lose interest in reporting or lose interest in transporting witnesses to these respective courts. So as a way forward, I think we need to gazette the district courts or the village courts into chief magisterial courts. Thank you.
My name is Grace Omoni from the University of Nairobi. I'm a director for the School of Nursing Sciences. I'm going to talk on bullet 1, where we will love, as a University of Nairobi, to collaborate in research with other collaborators, because these are some of the areas where we want to strengthen and build capacity. In bullet number 4, I stand here on a different hat. I am a president for the African Continent Midwives Associations, and I am looking at it and I'm seeing an opportunity here. If we started to do anything on IPV, we would really be able to get a lot of groups in different countries, except the Arab countries. Those are the ones I don't deal with. But all the African English and French and Spanish speaking areas we are in it. So these are opportunities where we can be able to collaborate and be able to get people, it would be quicker for us to be able to get people on the ground who can be able to carry out some research as well. We want them to do that. Finally, we were talking with the colleagues and we were thinking we would look at our curriculums. We do know that within the curriculum there's something about violence, but we are not sure the depth at which we have addressed this. And we think this is the right time for us to review our curriculums and be able to start training students before they get out, so that it will be cheaper for us, 1, and 2, we already could have introduced the students to know what exactly they should be able to be looking for. I have a student who is doing a PhD on forensic nursing, and is the first student in Kenya to do that. So this is I wish I knew what we were going to get into. I would have got her to come here. Thank you.
My name is Anne Kihara. Yesterday I introduced myself as a university lecturer. Today I'll come with a different hat. I'm actually the chairperson of the Kenya Obstetrical and Gynecological Society. And to be honest, the last 2 days has been an eye-opener. Not that I haven't thought about it, but in every realm of reproductive health, I think IPV is rampant. Think of the pregnant woman. Think of the woman trying to get contraception. Think of the woman aborting. Now, there are 2 arms I'm coming with. One is I've met a lot of people we can collaborate with to stretch this agenda as a research entity. Secondly, advocacy. And with the advocacy arm, I'm actually asking for help. I do give a lot of talks in our country on SRH, and I'd really wish we could start looking at communication strategy across the lifetime spectrum, from the very young child to the reproductive woman to the elderly woman. How do I communicate to those groups? And then thirdly, looking at the crowd that's here, can we get a platform where we can intercommunicate? And lastly, I have my friend here from EXA. He's right behind me. We spoke together yesterday, and we're actually trying to look for ways to have a platform for dissemination of reproductive health in East Central Southern Africa. And I'm actually going to take the mantle he gave me yesterday to actually see if we can get a college where, even if it's a virtual college of excellence, to really look at some of these burning issues, such as IPV and gender-based violence. Thank you.
I think we have at least one more. We have one more here, one more here. Anybody? Oh, and another one from over here, and one more here, and two more there. But that's it, because I promised the panel they would each get one last comment, and we need to wrap up. Go ahead.
Hi, thank you. I'm Sophie with Raising Voices, and my comment is really about this second bullet on communicating effectively, and probably, quite evident to all of us in the room. But if we look across some of the successful interventions that we've learned about, they all share a really fundamental approach to address gender inequality and shift social norms. So this work of prevention is political. It's about changing power and the way it's used. And I think when we talk about scaling up and recruiting, especially new allies in these efforts, it's helpful to be really explicit about this focus and the approach that we're taking in this work.
Okay. Batema is my name. Sister Batema, right? Mine combines all, but zeroes down to the individual in this room. Such rich gathering, such rich society, rubbing shoulders with the lowest and the highest. And we are talking at the same wavelength of IPV, means that all of us are experts. All of us have got the power. And all we need is the will. First of all, I want to encourage all the men in this room that the ball is really in our court. We have lived under patriarchy for all these centuries, and we haven't achieved much. If we are thinking about women in development and women and development, we must begin thinking gender and development. The ball is in our court. It is we the men to come up and identify ourselves with heads up and walk proudly as sisters. And just like the 7D people born again, there are barriers which pull us backward. As we move towards heaven, Satan is pulling us back. Don't listen to Satan. Don't listen to the forces pulling you backward. Just know that you are moving in the right direction. As an individual in this room, you have my support. as a man, you have my first support. Because before I joined the movement, I thought I was truly a man. Now I know I'm truly a man. I wasn't then. Personal. Can we commit ourselves to what we can do, each of us? The little grain of sand we shall add to this building of fighting IPV. I've had the resolutions. Let's revive this. Let them do that. Let me, I. Right? Much as the three fingers are pointing at you, you are not seeing them. You are saying, let him do that, and then the three are saying, how about you? Let them do that, but me, what's your resolution from here? What are you going to do as a person, in your small capacity, in your own individual power? Let me share with you two things. I went to the bank to open an account, joint account with my wife. And the bank manager took me aside, said, let me tell you, women are thieves. Don't put her on your account. If you put her there, limit the amount she can withdraw. Don't even allow her to have an ATM. I'm talking to you as a manager. So I walked out of the manager's room and went to the open lobby and went banging every table. You're stupid, I'm closing all the accounts here. How dare you call my wife a thief? And the security was like, please, excuse us. But that was enough to send a very big lesson to those who work in the bank and those who were in the lobby at that time. Are you ready to shout about IPV gender equality? Or you are not? The other day I was delivering a talk at Imperial Royal and I asked the minister, why are the women who got pregnant expelled from university? And I asked a silly question. How many times will this pregnant woman get pregnant again in 9 months? Some said 0, others said once. I said, she's already pregnant. Now, how many more girls will the boy impregnate in 9 months? So who is dangerous? Who should be expelled? We should take this crusade to our schools, to where we are body members, to where we are part of the school management, to where we are owning hotels and bars. Let's talk, let's walk the talk. From here, in your home, what are you going to do? From here, at your university, what are you going to do? From here, in that bar where you drink from, what are you going to do? From here, what are you going to do in your bedroom? Thank you.
Thank you very much. My name is Dina Akalo from Uganda Joint Christian Council. I want to respond on point 2, which says how do we communicate more effectively. Yeah, I think to exhaust that issue of communicating, from our experience, drama groups formed can really communicate very well to across the board. Now, because we carried out a study recently, and most people like drama really communicates. So you coin a drama around the message that you want to pass, and you just play it there. It will communicate more than even any other method. And then also, most rural communities listen to the radio. Radio is also very effective. You can have a radio talk show. And like I said recently, we had a study also across the institutions. We sampled 4, and we realized that even there are no policies in institutions, so the victims of IVP don't have where to go. And we said, okay, dialogue with the university administration is also very important so that they institute some policies. Thank you.
Thank you. This is the very last. I just wanted to speak to bullet 5, opportunities to coordinate. And I wanted to let everyone in this room know, I'm Jean from Raising Voices, that we've got a network that we coordinate at Raising Voices, the GBV Prevention Network. It's a regional network with over 500 individuals and organizations and institutions that are addressing gender-based violence in the Horn, East and Southern Africa. I think Laurie displayed her contact information, I hope. If not, it's in the materials. You can contact us at Raising Voices to get in touch. Many of you here are part of that network. And so I urge the rest of you to use that platform to put out information and to collaborate with others.
All right, we have our two over here still. And they're going to end us. Ah, that's right, there's one more over here. We need to go quickly.
Yes, very quickly. My name is Mary Kabaru from the Ministry of Devolution and Planning, Kenya. I'm speaking to bullet number 1 on the research area. By really looking at Kenya in particular, the government has invested a lot of money in economic empowerment programs for women, about $2.5 billion US, and really we would want to follow up on that in a way of research to really see whether that kind of program is contributing to the reduction of IPV, including domestic violence, or whether it is working against women. I think for us, this is where we would like to move forward in terms of that bullet 1. Thank you.
Thank you. Julia Sachingus is my name. I come from Communication for the Women Foundation, Uganda. We, as an intervention, established a hotline, and the hotline we get feedback, which I've actually got from most of the presenters up here. What's happening, like the justice said, so many men have come up and they're really not interested in what is going on, but they're just shying out to bring out this. When you note, when we established a hotline in 2009, we noted that during that time, the statistics of our callers, 80% were actually men. And GBV is one of our core issues. When they share with you how and what they go through, what they really experience, these people, how they're sharing, you realize that they are really touched with what is going on. Recently, we got someone who referred to as a client, and the discussion was it was going to reach a level where someone is going to end to commit. He was actually proposing to end her life because of what had really happened. And during the intervention with our counselors, we realized that this person did not have information, and instead of slaughtering her as he thought he would, we wanted to know whether just her having a child in her home that is not a real father, of if he would end her life, would really make, if he would commit, kill her, would just make her satisfied. But in the sharing, we noted that some people just need someone to talk to. They want someone to talk to silently, not openly coming up, but they're also feeling that if the struggle can go on, there are so many other men down there who are willing to come up and join the struggle, only that they are not really able to come up. So I'm thinking one of the interventions or barriers to communications hotline, people need special ways or special forms of communication they can be reached to. Still, the hotline will reach people who cannot be reached, who cannot probably call or go to police and report on their own. But when we talk to them and communicate, we are able to refer to them to places, different places they didn't know they could probably access or get support from there. So to me, hotlines could be one way of reaching them if we really well implemented. Thank you.
And our last word from the audience. There's a lot of pressure on.
Thank you. I'm Kamisha Josephine, and I work with Center for Domestic Violence Prevention. So somehow, Sister Batema read my mind, and I would like to re-emphasize the issue of us starting with self, and in line with us thinking about how well are we using the information that we have from research at programming level, but also at networking level, and learning from it and helping people around us to learn more about IPV and what they can do to prevent it. Sometimes we get very comfortable and present ourselves as champions, and we close out our mind to learning and using other experiences to inform our own work. So my quick recommendation is that we do the self-checks and see how well are we using it, how are we packaging the information to simplify it for even those that do not sit in the spaces like we are seated, to be able to relate with it and also feel it's relevant for them to come on board without using punitive language. So I think that's one thing we need to start doing.
Thank you. I promised the panel we would have one last comment from each of them. So I'm going to start at this end this time, Ian, and we'll go this way, and so that our director of UNIS can have the final word from the panel, and then, of course, you know I've got 2 more words to say.
Very quickly. Going forward, I think we have to be strategic. We've heard 100 great suggestions in the last hour or so, but we have to pick and choose, we have to prioritize, we can't do it all. And I think that's the task going forward for us, is take advantage of all these great ideas and strategically pick on the few that we can go for, that will have the most effect most immediately.
I would say what Ian said, but then I'll flip it differently. Yesterday, as we were having a discussion, one of the questions that were asked, and we did not answer that immediately, was, why is it that in a big country like Uganda, the services are scattered and are not everywhere? And what is it that the government is doing to make sure that the services are in all the spaces? We have the answer now. That we need to anchor IPV with a coordinator with development. If we don't do that, we're not going to get a coordinator who especially is within the government, who knows how to look at the issues of finances, who knows how to look at the issues of prioritizing as to where we should go and when. So it's important to be very strategic and make sure that we have the right people, the people who are able to guide us through the really murky waters for us to be able to address ourselves to intimate partner violence. Thank you.
I think my biggest question here that I'm throwing to everyone is I would like to re-emphasize still what Nduku said. We need to be thinking of what are the standards and the principles that are guiding this work that we all have to agree to, and then we are bound by that, such that we even start to have like harmonized curricula for the different sectors, so that we know if we are working with the police, this is the one curricula that we are using. It doesn't matter who you are. Even we in programming, what's the curricula? What are those maybe 10 things that each one of us should learn and maybe unlearn, so that we are able to do programming that is not going to create harm? And of course, this is to us programmers, especially here in Uganda. Often, I think we find ourselves as closing our little cocoons, and we do not open our eyes to learn. I think let's challenge ourselves. We need to have this continuous learning and continuous improvement, so that we keep picking and adding. And then also knowing that if the next level, for instance, if I refer a client, a survivor to the next level, and things haven't happened well, instead of lamenting and condemning that next level, our biggest question should be, how can I work with that next level to improve that? To me, I think that's extremely critical. So, because there is no one person who is going to do it, that kind of role is not within your side. So use your critical eye and your learning to support that particular level to do their bit well. Thank you.
Yes, so briefly, at the end of the day, with all these discussions and the different pieces, I think what we are aiming for is to make a difference in the different countries. So my proposal which may be a question, or depending on how you interpret it, is we need in the different countries to develop an integrated multi-sectoral country response mechanism, an integrated multi-sectoral country response. So somebody needs to take that up to see how do you develop this kind of response for IPV.